Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
Welcome back to our series exploring the vital role nurse navigators play in healthcare. Thank you, Alpha LaFleur, for continuing this discussion.
Thanks again.
In the previous episode, we got to focus specifically on the role of the nurse navigator, really defining those core responsibilities and competencies of nurse navigators. And now we're going to continue the discussion of this role, but our focus is going to be more on the practicalities and those unique challenges in the professional and lifestyle factors related to being successful as a nurse navigator. So Alpha, how does this role differ based on the type of healthcare setting you're in, say hospital versus clinic versus a cancer center, where you are? How do those differ?
I would say for when the patient is outpatient, they are, I think it's a little bit more easier for them to get in touch with us and navigate with us. Once they are inpatient, when I'm still dealing with them from an outside provider perspective, I more reach out to them and ask, what's going on and where can I be helpful? If we're flipping it the other way and there's a nurse navigator that works on the inpatient side, all those providers are kind of at their fingertips, social work's down the hall, case management's, on the second floor. So I think it's a little bit easier to navigate that process for the patient when they are inpatient, as opposed to outpatient. But there are, again, barriers everywhere, and, but we're fully capable of meeting those challenges and working around whatever barriers that come up.
Now, since you're outpatient, so you have a patient that maybe you have to send to the hospital. Somebody that, has been with you for a while. Do you then still reach out to them in that nurse navigator role throughout their hospital stay and throughout that treatment that they're getting?
Right. I reach out to them more as a sounding board. Tell me what's going on. How are you feeling in there? How, I've gotten to know them at this point. I know,
Yeah.
what other things they're dealing with. How's mom and dad? How's, Billy at home? What's going on also that, that I could help with that, because they're already kind of covered, I would say, a little bit when
Yeah.
they're in the hospital. But what's going on at home that maybe, because you're not there, that may be falling through the cracks, that maybe I can assist with. So, we take on a little bit more of a, so, social kind of
Yeah.
role in that.
Well, their story when they're
Right.
established with you,
Exactly. We
and you
gain that
kind of,
trust. We know, what's
yeah,
going on at home, and we want to keep that part of their life also still moving forward. So that's where I feel like our role transitions a little bit once they're inpatient.
right. What are some of those key metrics, those outcomes that you can show to demonstrate the impact and value that nurse navigators have? Especially somebody who's maybe trying to show like, hey, this really is a valuable role that we need to look at and create.
That's a hard one to answer. I mean, there are core competencies that we have as nurse navigators, and, when we are charting in our systems, we try to keep things standardized so that across patients, you can see, what was done and what wasn't done. So that when records are looked over, we've checked some boxes, that the patients need in going forward. And then when you're pulling out that data and able to see, okay, what exactly did the nurse navigator do? It's all there in like a standardized form. So you're not,
Right.
trying to piece through different documents and different things to try to find out what exactly it is that we did. So it is not a straightforward process as as the bedside nurse. You can be able to
Right.
see what they're doing, but we are trying to be able to document what we do as close to possible as what the bedside nurses do, so that we can show our worth of what we are accomplishing.
Absolutely. And I know since you're working as that nurse practitioner, but then also, fulfilling a lot of the nurse navigator role, you probably it's probably easier for your clinic to really make sure that their patients' needs and voices are being heard, because then you can automatically you have that scope of practice where you can do something about a lot of it. But what about, say, the nurse who is in the nurse navigator roles? How can they best advocate to make sure that there's patients that the patient's needs and their voices are heard?
So I would say you kind of have to be that little engine that could. You keep pushing, towards, and that squeaky wheel gets the grease.
I
So
was
if you
gonna
keep
say,
if
is
you keep at it, you cannot be ignored for
yeah.
too long.
So
So
it's like the annoying mosquito, or is it the little
exactly,
train that could? Which one?
exactly. And I've always said to providers when I've gotten that feedback, "Oh, you're reaching out again," and they don't say it in so many words, but you
Oh
know,
yeah.
it's much better for me to be reaching out to you because I'm giving you, the concrete details. This is what's going on, and this is what we need, versus like the patient calling you and, I hear from the patient. So I'm getting the whole story, for, all the time that they have to give because they've
You
got the time.
you
You as
got the
a
earful.
provider, exactly. You as a provider don't have that time. So you'd much
Hmm.
rather hear from me giving you just what you need to know and here's how we can possibly fix it than
So
having
you're
that
S
paper.
barring. You're
Exactly.
S barring to them
Got it.
instead of giving them an earful.
Exactly, so, you don't wanna hear, maybe from the patient that's kinda going around the barn and over the fence when I
Yeah.
could be giving that to you, and if, you take it from me and kinda give me what I want, then we're all
Hmm.
happy, right? And, everything gets done
Right.
much more effectively and efficiently, if we can handle it that way.
Absolutely. What are some of the in this role, and going back to specifically to the patient, but what are some of those biggest educational and informational needs that you have seen that patients and families need for the nurse navigator to provide to them?
So, obviously, their diagnosis, if that's obviously gonna be something new to them, so they're gonna wanna
Hmm.
hear a little bit more about, "Okay, so what does that mean going forward?" So, I don't want to step on, like, physicians' toes, especially if they need another, provider to come in.
Hmm.
Um, in the oncology space, we definitely use other specialists when things come up, cardiologists, endocrinologists. So and I am not a cardiologist and I am not an endocrinologist. So I don't want to step on their toes as far as what
Yes.
that means going forward. But if they have questions, I can, step in right then and there, much sooner than if
Mm-hmm.
they were to try to reach out to that cardiologist's office or endocrinologist's office. And if there's more information that they need that I can't provide, well, then maybe I can reach out to that office, that office's nurse practitioner, or that office's a navigator if they have one, and
Mm-hmm.
bring them in as well. So I just think I'm still that first point of contact, um, to be able to at least bring them down off the ledge. We've given them this
Right.
diagnosis and they're afraid and confused. Let's at least bring them to a point where they feel, okay, I grasp this amount and then I have this navigator that can fill in the rest.
Mm-hmm. That's so good, because I know that rare, the my daughter has CRPS, which is very rare. And nobody really knew what to do. So I walked out of the clinic, the orthopedic clinic, and I'm like, well, what do I do now? Nobody told me what to do. Nobody told me who I was supposed to see or where I was supposed to go with this. And I walked out with nothing. And so having that nurse navigator be able to say, hey, these are your next steps. Let's
Right.
walk through this together. That would have been huge for us. And, we would have got treatment faster.
And
Um,
especially how you say those next steps, because sometimes immediately people go to step 50 when we're still in
yeah,
step one. Let's just work right in this space right here for now. And we may not
right.
even get to step 50. So let's bring it
Yeah,
back. Let's focus on what we need to do right now and how I can help you
yeah.
make step 1 through 5 work.
What is
And
step one?
yeah, exactly.
Like,
And help
what
me
do I
worry
do?
step 50. So, but,
Right.
that's where immediately your brain goes, what does this
Yeah.
mean? What do I have to do? And okay, let's bring it back down. And
Yeah.
here's what we're going to do first. Here's who we need to speak to. Here's what we need to do.
hmm
And
Yes,
that
and it's
helps.
so weird because, like in our instance, CRPS is a nervous system issue, and so your mind automatically is like, well, then do we need to see a
Neuro-
neurologist? Well, no, it's actually a rheumatologist that
Okay.
usually follows CRPS. I had no idea. Nobody told me. So like you said, step one, like, well, what do I do next? Let's make an appointment with this specialist, and let's get you where you need to be.
Exactly.
I had no idea. Um,
And we also help with getting those appointments to specialists faster than if you were to just, call out of the blue and say, hey, I need an appointment with so and so.
yeah.
Because we've built that foundation with these other providers to say, hey,
hmm
this is what's going on, and we need them to be seen sooner rather than later. So that's also a benefit we bring, as
Oh,
being
that's
part of the
good.
team.
Yes. Oh, I wish I would have had you
Oh,
like a year and a half ago to help me. I think we're where we're supposed to be now, but how much faster we could have
right.
got there if we had someone with a bird's eye view that could help us navigate through everything we needed to navigate
Absolutely.
through. So, we talked about kind of those educational, informational needs, but what about the how you can effectively connect patients with community resources and support services? Like, what kinds do you connect them with?
So we're also familiar with our local um, support that's out there too. Like I said, churches, sometimes food banks, all those kinds of things that are in our immediate area. But we do have patients that come from outside of our immediate area, and then that's a little bit more difficult, but we have the internet. So I'll do my own little digging. If I know you live, in this area, well, I'm going to start looking in that area for you to try to say,
hmm
hey, this is available in your area. And then sometimes once I reach out to them, they know so many other things in their area because obviously that's where they are, positioned.
Right.
So it's about reaching out, making those inroads in communication with other people. And I have my setup online with, who to reach out for in what area. And I keep
hmm
those lines of communication open. So, I'm just always building on who I know, who can I bring in also to help my patients. But then if it's more of a nationwide type thing, like for some of our diseases, there are nationwide support groups. Or financial benefits. So,
Right.
I also have, that information available to give to patients that, hey, if you have, like multiple myeloma, well, here's the multiple myeloma group that,
hmm
can help also guide. So, I'm trying to be that. I don't want to say I can be everything to everyone because there's so many
Yeah.
other people that I can also bring in that can, they're the expert in what they do as far as maybe like finance. So let's bring
hmm
that person in and have them. Because again, I can't be everything to everyone all the time. So I just need
hmm
that help but I just know how to coordinate that help for them, if that makes sense.
Right. So, why should you do that as the nurse navigator versus the patient doing that on their own?
Again, that is so much for the patient.
It is.
You were saying before, like you hear this diagnosis and you freeze or you want to run away. I guess that's the other, opposite end to it. And neither one of
Uh-huh.
those are viable options. We've got to, do something and kind of make it through.
Yes.
So, as nurses, our hearts want to help. So, we want to take that burden off the patient, to be able to guide them to where they need to go, who they need to speak to, what they need to do. So, without that, they're just lost, and it's too much. And then we end up with patients that aren't getting the care that they need in a timely fashion, effectively,
Yeah.
efficiently, and all of that. And the outcomes aren't good.
It's overwhelming, I think.
It is.
Speaking as a mom, going through this, it's been so overwhelming to digest everything, to figure out, first of all, what this diagnosis is and how do you treat it, and what resources are out there, and so much to think about.
Right.
And you're
That's why.
tired, you're
Right.
supporting them, or you're in the midst of it because it's you.
Right.
It's
And patients go through phases. So there are times when you feel like, okay, I got this. I know what I'm doing. I feel okay. I'm okay with where I am right now. And maybe they don't need you as much, and that's okay. And then
yeah.
maybe something happens, or a little, change in regimen or something like that. And it's like, wait a minute. Hands up, I need some help with what does that mean now?
Yes.
So, and then I might be able to come on board a little bit more. So, patients kind of go in this roller coaster phase. I need you a little bit more today than I needed you yesterday, or something like that. So, that's why we're
Yeah.
always communicating, assessing where our patients are, to know how
Yeah.
can we be helpful.
And in today, they might could do more than they could yesterday,
Right.
in a better place emotionally, mentally,
Exactly.
physically, it's like right now my daughter's on the path to try to get better, and she has days where she is just so frustrated with where she is and
Hmm.
why she's here. And then there are days where she's like, I'm gonna kick its butt. Let's go.
Exactly. And we're here for all of
So
that. So,
that's
sometimes it's just a listening ear. They don't want
mhm.
anything more from you than just to listen. I feel really tired today. Um, you know, and we're just like, yeah, I hear you. That's, part of the side effect of, this disease, or, this treatment. And,
Right.
once they have that, someone that just heard them out maybe for a couple minutes, and then okay, they're okay, and then they can keep going. So,
Yes, you're right. So, how do you see this role fitting into like a larger patient-centered care or even a care coordination model
mm.
within healthcare?
So again, I think we have to get more stakeholder buy-in with the importance of this role. We are coordinating so many different things, and trying to get these all of these silos to kind of line up and match up for the patient. So,
Right.
you know, and sometimes it takes that person maybe in leadership to kind of follow us for a little bit, and kind of see what it is
Mm.
that we're doing, and how that
What do
really
you
benefits,
offer?
right, what that
Yeah.
really means for the patient, to try to see that, how much is at stake for that patient on a day-to-day basis, and how much we benefit them. So, you may not see all of our outcomes on paper or something like that, but, when you see that patient, their eyes just change from complete confusion and fear to, knowing that, okay, I'm going to be okay. That is
Yeah.
what we need them to see, to be able to expand this role, to be able to just move forward as a profession.
Yeah. And so, for this profession, what organizations or even networking groups really exist for nurse navigators where you can share your best practices with each other?
Um, So I would definitely, in the oncology space, because we have that whole oncology nurse navigator piece, we are always
Hmm.
communicating together. I would feel that would be the same for those other ones that I mentioned previously, like in cardiovascular and diabetes, that they would kind of be working together.
Right.
And I'm not 100% sure if there's like a just overarching nurse navigator kind of like conference. But
Mhm.
that would be amazing too, to share best practices from different disease perspectives, from inpatient to outpatient. Like, what do you do different than what I'm doing
Right.
that could benefit my patients? How are your stakeholders seeing your benefit and uplifting that to where I can get mine to do the same thing? So definitely, we don't want to be in silos either, kind of doing our
Yeah.
own thing. We want to be working together to bring that, evidence-based practice for all our patients.
And unfortunately, in healthcare, we do tend to silo. And
Right.
I don't know
It's
why
it,
we tend to silo, but we do.
and I think it's a little bit of a kind of protection thing. Like, I know my role, so I'm just gonna stay in
Uh-huh.
my lane. Um, but it's sometimes that doesn't work for the patients, and most of the time that doesn't
Right.
work for the patient. That's who we're here for.
Yeah.
So we need to kind of break out of our silos, to use that word again, and just kind
Mhm.
of come together. What can we do? And if you come at it from a "what can I do" perspective,
Right.
instead of just a "oh, I'm here and this is what I'm gonna
Mhm.
do," then I think it's definitely more helpful in that way.
It's like instead of having our separate lanes, how do we merge our roads
Right. We
together
need to merge,
so that, yeah, our
put this
areas of
patient
expertise
care.
together could take care of that
Absolutely.
patient?
Right.
Yeah. What legislative or policy changes do you think could really help with expanding and establishing nurse navigator programs?
So, actually, starting on January 1st, there were some new changes in how CMS is billing for nurse navigators.
Oh,
Um, for
that's
as of
helpful.
right so there are new CPT coding that can help with billing, so that we can actually, see where this money is going. Um,
Right.
For right now, it is for the oncology side of things, but I am hoping that that will, just like with the role, these billing practices and money for navigation will also transition to other disease processes. Um, like with the, navigation process, step 1 and step 2, everything
Mhm.
kinda moves at a certain pace, and I'm hoping we kind of move a little quickly with this, but, it's a start that they're actually seeing our worth and seeing
Yeah,
that, that part of it.
absolutely. And CMS is a foot. You have a foot in the door,
Right.
um,
Exactly.
to show how helpful this is.
Right.
And
'Cause
maybe, I
once
mean,
CM
even diabetes. I would think this would be huge for diabetes.
Exactly. But once CMS is on board, the other, payers typically start to say, "Hmm," and
Hmm.
hopefully they also join in as well.
And I could really, listening to this, I could see this nurse navigator role making sense being in like insurance. You know how they have case managers sometimes in
Right,
insurance, but like having somebody who is a bird's eye look at your care, it just seems like that could maybe fit there too.
right. And speaking on a more personal note, my mom was trying to get some things through her insurance covered, and what she said to the physician somehow got translated a little bit differently. And now the insurance is calling her and saying, "Well, first you need this, that, and the other." And it's like, "No, that's not what I need." So she spent so much time trying to, navigate this herself, and she just got frustrated and kind of gave up. Fortunately for her, this is something that we can kind of work out on our own, and if insurance isn't gonna cover it, we can just, take care of it. But that is not the majority of people, in the United States.
Yes.
That if insurance doesn't cover it, they're not getting it, and bad things happen. So if she could have someone that she reached out to and said, "Here's what's happening from the provider side, here's what's happening from the insurance side. They
Hmm.
are not communicating, and I'm just left out here trying to communicate, and I just can't anymore. How many phone calls? How
I
many
know.
hours?"
Yeah.
Just like, enough. So
Right.
And if there was someone that she could reach out to that was her point of care at the insurance and
Mm-hmm.
says, "Here's my problem. Please help me fix
Yeah.
this." And they just went to work and fixed it, that would be amazing.
And well, I had my daughter was she was really young. I have multiple daughters. I have three daughters. So one of my other daughters, she needed to have something done for her eyes. It was a surgery, and she was pediatric. She was like 3 or 4, and the referral came back from the insurance company. They were sending her to a ophthalmologist that specialized in geriatric type
Mhm.
conditions, and this was a pediatric
Right,
condition. And so I'm calling the insurance company and they're arguing with me. And they said, well, our expert says that this will be just fine. And I said, well, who is your expert?
right.
And nothing against our roles as nurse. It was an LPN who had no background in
Mm,
pediatrics or ophthalmology, who just was like, oh no, this will be fine. Because I'm like, well, let me talk to your
right,
expert and let's fix this. So thankfully the physician, the pediatric physician, they really bulldogged the insurance company as far
right.
as like sending them letters and saying this is why they need to come to us and not to them, and all that stuff for us. So thankfully that physician fought for us. But how great to have replaced that expert area with a nurse navigator,
Right.
somebody who, you have direct access to, physicians have direct access to, who can really make a decision based off of evidence and
Exactly.
not just being like, oh, yeah, no, it's fine.
Yeah,
They can see another ophthalmologist.
absolutely. That is
Hmm.
absolutely right.
Yes. So, how in this role, I know that you get to really build your trust and rapport with your patients as you're seeing them. But how do you quickly build that trust and rapport with patients from diverse backgrounds?
Mm. So that's also a special spot for me. I actually had recently a patient that is Spanish speaking.
Uh-huh.
So then I'm also having to bring in someone else that can actually speak to them when with me when I'm speaking with them because obviously I don't speak Spanish.
Yeah.
So that's something else we coordinate too. Getting in translators for sign language if we need it. All of these things. If they have a religious background and have a relationship with their pastor, sometimes I reach out to them too. Like, is sometimes they just want someone to pray with and we can
Right.
kind of help them, coordinate that. Why don't you reach out to your pastor or your church group or something like that? Just
Mm.
reminding patients they have so many things that they're thinking of and trying to deal with that sometimes they don't even think of those simple things as something that could
Mm-hmm.
be beneficial to them.
Right.
Right? And then with different just other country backgrounds or something like that. Again, we live in a city with so many different patients and so many
We
different
do.
types of you know uh
Mm-hmm.
communities. So I've reached out to different communities and just to see what's available for our patients, and it's always an option. They don't have to um take me up on it or take them up on it,
Mm-hmm.
but if you're bringing some things to the table and giving them these options, they feel much better that someone took the time to look for this for me. And even if that's not
Someone cares.
exactly even if that I'm not, ready to sit in a group and talk about this, someone took the time to find that for me. And then maybe down the road that might be something I want to do. But, they have you've built that trust with them by
Mm-hmm.
listening to them and really learning who they are as people and not as patients. That, that's so beneficial for them. I can't even explain it.
It is, for sure. Alpha, you have such a heavy role. I mean, you get to know your patients on such a personal level and see their struggles and be with them through their struggles. And it's heavy. I mean, it really is. And I appreciate your love for your patients and what you do for them and making sure that they have a holistic care plan and not just, here's you a prescription or
Right. You got
sending
it.
them off to somebody. Oh, I love your passion for this role. But I do have to ask you, how do you prevent burnout what are those self-care practices that maybe you have in this role? Because this is a demanding role on you.
It is, and, sometimes I go to bed thinking about, "Oh, I gotta call so and so," or I'm just thinking about, "Oh, they got a little bit of some bad news today, I wonder how they're really taking it." Um, but I do kind of journal. So I'll write down a little something, something just to kind of get it out of my head and onto
Mhm.
paper. And that kind of,
That's good.
releases it a little bit in a way. And then, I like to spend time with my family too and just be grateful and thankful for, who I have in my life that also pours into me as I'm pouring into my patients. So, you know,
That's
that's kind of
good.
what I do to prevent, that burnout
Yes.
feeling.
Oh, yes, said you have to let those emotions out, and so
Right.
journaling is such a good idea. I know a lot of people that don't do that, that it really does help to just write it down
And
and get it
whatever,
out.
whatever you like to do that, but
Mhm.
like I said, you do need to get those thoughts, those feelings out, because, it is a lot. You take on your patient's burden sometimes, and, you know, that that can lead to burnout, and you don't wanna burn out because you wanna be there for your patients and continue in your role.
Yes, it's a lot to carry. So we're coming to the end of our episode, and the nurse navigator. When I look at the name navigator, of course, I obviously think of a plane.
Mhm.
Navigators helping pilots know where to go, and yes, we're helping patients know where to go. But you're also, I think, of driving that plane, so to say, a personalized care plan, really driving that care plan between patients and the multidisciplinary team. See, those are some good visuals.
Absolutely. And also the guy on the tarmac with those, whatever those things are called that are kinda like guiding the
Yeah.
plane, which way to go. We kind of, wear so many hats. So, it's whatever is kinda needed at that moment. But definitely that is a great visual for the patient to kind of see. We're, the pilot kinda guiding driving the plane. We're also navigating the plane of where to go so
Mhm.
that, you have the best outcome possible.
Absolutely. This is such a needed nursing role in so many areas, especially because we're seeing medicine become so much more complex and fragmented. And
Right.
so having, someone like you who not only are you a provider for them, but you're also dedicated to really demystifying the healthcare system
Right.
for patients, helping them proactively identify needs, ensure seamless care transitions. Yeah, it's so essential. I see your role as really being at the forefront of that paradigm shift that we're seeing in healthcare, helping to break down our silos, like we
Right.
talked about, and really serving as just an indispensable member of the multidisciplinary team. I think that their impact really represents a pivotal investment in a patient's experience and in achieving better health outcomes, which is really where reimbursement is going.
Right.
It's going to patient experience and it's going to patient outcomes. So, I really encourage all of our healthcare leaders who are listening to this podcast that are tuning in to really closely examine how maybe they could embed navigation and enhance their ability to deliver coordinated care, deliver equitable care for communities as well.
Absolutely.
Um, and I think it's important to not be afraid to start small with limited,
Exactly.
disease areas. We
The
know that
first step that
oncology,
I said to myself, it might look different, um,
yeah,
you know, in a primary care office versus a cancer center versus,
hmm
inpatient. It's going to look different.
versus
But
insurance if they
but
take it on.
exactly. But a start is a start. And,
Yeah.
take what, you can learn from other, like we were saying before, learn from other navigators in the role, other people who do the job, and see how can you incorporate that into your clinic, into your, health system. So that, because in the end it's all about the patient. How can we benefit the patient? How can we get that patient experience scores, to be where we want them to be? So I think that's where we're headed.
Absolutely. For anybody that's interested in pursuing the Navigator role, I really hope that the series has really highlighted the unique value and empowerment opportunities that this career path could really bring and being a voice for patients. Thank you for joining me for this discussion, Alpha.
Thank you so much for having me. This was great.
It was a joy to spend time with you, learning a lot about this role. So to our listeners, I encourage you to explore many of the courses that we have available on elitelearning.com to help you grow in your careers and earn CEs.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.
Thank you.